After Margaret got her Alzheimer's diagnosis, her daughter asked the question every family wants answered: what can we do to help her? Robert's family asked the same thing after his stroke led to vascular dementia. So did Susan's family when Lewy body dementia brought frightening hallucinations, and James's wife when frontotemporal dementia changed his personality completely. Today, I'm giving you an honest look at what treatments actually work for different types of dementia. I'll be clear about what these treatments can and cannot do, because managing expectations is just as important as understanding options. The truth is, we don't have cures yet, but we do have treatments that can slow progression, reduce symptoms, and improve quality of life when used correctly. Let's explore what's really available for families facing these diagnoses. Margaret was 72 when her memory problems led to an Alzheimer's diagnosis. Her family learned that while there's no cure, there are several FDA-approved medications that can help slow cognitive decline and manage symptoms. The first medications her doctor discussed are called cholinesterase inhibitors: donepezil, rivastigmine, and galantamine. These work by increasing levels of acetylcholine, a brain chemical important for memory and learning. Margaret started with donepezil, the most commonly prescribed medication for early to moderate Alzheimer's. Her doctor explained that these medications aren't dramatic game changers. They might slow decline for 6 to 12 months, potentially helping with memory, thinking, and daily activities. Some people notice improved motivation, less anxiety, or better ability to handle familiar tasks. Margaret's family saw modest improvements in her confidence with daily routines. However, these medications come with side effects. Margaret experienced some nausea initially, which improved over time. Other people might have vivid dreams, dizziness, or loss of appetite. Margaret's doctor monitored her closely and adjusted the dosage to find the right balance. When Margaret's condition progressed to moderate stages, her doctor added memantine. This medication works differently, protecting brain cells from damage caused by excessive glutamate activity. Memantine can help with agitation, aggression, and some thinking problems that appear in later stages. Margaret's family also learned about newer, more controversial medications. Aducanumab and lecanemab target amyloid plaques in the brain, but their benefits remain debated. They're extremely expensive, and they carry serious side effect risks, including brain swelling. Margaret's doctor explained that the evidence for these drugs is limited and they're not routinely recommended. The key message Margaret's family understood is that Alzheimer's medications work best when started early, but they only slow progression. They don't stop or reverse the disease. The benefits are modest, and not everyone responds to them. Regular monitoring with her medical team became essential for adjusting treatments as her condition changed. Robert developed vascular dementia after a series of small strokes. His family learned that treating vascular dementia focuses primarily on preventing further strokes and managing the cardiovascular conditions that caused his brain damage. Unlike Alzheimer's disease, the cholinesterase inhibitors don't typically help with pure vascular dementia. Robert's treatment centered on aggressive management of his blood pressure, diabetes, and high cholesterol, the conditions that led to his strokes in the first place. Robert's medical team prescribed blood pressure medications, cholesterol-lowering drugs, and blood thinners to prevent future clots. They optimized his diabetes control and addressed his irregular heart rhythm. These weren't dementia-specific medications, but they were crucial for protecting his remaining brain function. However, many people like Robert have mixed dementia, both vascular damage and Alzheimer's changes in their brains. When brain imaging suggested Robert also had some Alzheimer's pathology, his doctor tried donepezil to see if it would help with his memory and thinking problems. Robert's family learned that vascular dementia prevention is often more effective than treatment after damage occurs. The medications that prevent strokes and heart attacks can also prevent further cognitive decline, but they can't restore brain tissue that's already been damaged by poor blood flow. Before we continue with other dementia types, if this information is helping you understand treatment options for your family's situation, please hit that subscribe button. Understanding what's really available and what isn't helps families make better decisions with their medical teams. The progression of Robert's vascular dementia was different from Alzheimer's, more stepwise than gradual, and his treatment plan needed to address both his cognitive symptoms and his ongoing stroke risk. Susan's dementia with Lewy bodies brought visual hallucinations that terrified her family. She'd see people in her house who weren't there and have conversations with deceased relatives. Her treatment required careful medication management because people with Lewy body dementia are extremely sensitive to certain drugs. The cholinesterase inhibitors that help with Alzheimer's can actually help with Lewy body dementia too, particularly with hallucinations and cognitive fluctuations. Susan's doctor started her on rivastigmine, which reduced the frequency and intensity of her hallucinations without making her movement problems worse. However, Susan's family learned that many psychiatric medications used for hallucinations and other conditions are dangerous for people with Lewy body dementia. Antipsychotic drugs can cause severe, sometimes permanent movement problems or even life-threatening reactions. Susan's treatment focused on the safer cholinesterase inhibitors and careful environmental management of her symptoms. James's situation with frontotemporal dementia was completely different. At 58, his personality changed dramatically. He became impulsive, socially inappropriate, and obsessive about routines. His family was frustrated to learn that the medications that help with Alzheimer's don't work for FTD and might even make behavioral symptoms worse. Instead of dementia-specific drugs, James's doctor focused on managing his most disruptive symptoms. Sometimes, antidepressants help with the compulsive behaviors and emotional outbursts common in FTD. Sleep medications might help with the disrupted sleep patterns, but there are no FDA-approved treatments specifically for FTD, making it one of the most challenging dementia types to manage medically. James's family learned that behavioral interventions, structured routines, and environmental modifications were often more helpful than medications for managing his condition. The goal became maintaining his safety and dignity rather than trying to restore his previous personality. Both families discovered that realistic expectations were crucial. Medications might help with some symptoms, but they wouldn't bring back the person they remembered. While medications form one part of dementia treatment, non-drug interventions often provide significant benefits for all types of dementia. Margaret, Robert, Susan, and James all benefited from approaches that didn't require prescriptions. Cognitive stimulation therapy involves structured activities designed to engage thinking skills. Margaret participated in group sessions with puzzles, discussions, and memory exercises. Research shows this can be as effective as medications for some cognitive symptoms, with the added benefit of social interaction and mental engagement. Music therapy unlocked memories and emotions that regular conversation couldn't reach. Susan, despite her Lewy body dementia, could sing entire songs from her youth and became calmer during music sessions. James's agitation decreased when listening to his favorite classical pieces, giving his family precious moments of connection. Physical exercise benefits all dementia types by improving blood flow to the brain, reducing falls risk, and maintaining independence longer. Robert's physical therapy after his strokes helped prevent further decline, while Margaret's walking program improved her mood and sleep quality. Managing depression and anxiety became crucial for everyone. Depression affects up to 40% of people with dementia, and standard antidepressants don't always work as well in this population. Counseling, social activities, and maintaining meaningful routines often provided better results than medication alone. Environmental modifications helped all four families. Reducing clutter helped Margaret navigate her home safely. Consistent lighting helped Susan's hallucinations. Structured daily routines reduced James's anxiety about unexpected changes. The families learned that the most effective approach combined appropriate medications with these non-drug interventions. No single treatment was a magic solution, but the right combination of medical and non-medical approaches improved quality of life significantly. Sleep management, nutrition support, and caregiver education became essential components of everyone's treatment plan, often providing benefits that medications alone couldn't achieve. Margaret, Robert, Susan, and James represent millions of families navigating dementia treatments. Their stories show that while we don't have cures, we do have tools that can slow progression, manage symptoms, and improve daily life when used appropriately. The key lessons from their experiences: start treatments early when possible, have realistic expectations about modest benefits, monitor for side effects carefully, and remember that the best results usually come from combining medications with non-drug approaches. I've included additional treatment information and resources in the description below, but remember that every person's situation is unique. These treatments require careful coordination with medical teams who understand your loved one's specific type of dementia, other health conditions, and individual responses. What questions do you have about dementia treatments? Are you working with your medical team to find the right combination of approaches? Share your experiences in the comments. Your insights help other families understand what to expect from different treatment options. If this video helped clarify realistic treatment expectations, please subscribe for more honest information about dementia care from someone who understands these complex medical decisions. For more specific information about individual dementia types, watch this video about Alzheimer's disease progression or this one about mixed dementia. I'll see you there. Remember, hope lies not in miracle cures, but in the careful combination of available treatments that help people live better with dementia.